Hey, this is Dr. Deshpande. We just wanted to make a little video for you all to review the last doctor's visit that you had before you made the decision to go forward with hip or knee replacement surgery. This video is going to be focused on hip replacement surgery specifically. You will also be receiving information in a class regarding some of the details of the days before and the days after surgery, but I wanted to review the details of what's going to happen to you on the day of your operation. On the morning of surgery, you'll arrive either at the hospital or at our surgery center for your scheduled hip replacement. On that day, you'll meet me or the physician assistant that works with me, and we'll answer all of your questions that morning regarding what's coming in the next couple of hours. Right after we're done, or right before, you'll be visited by the anesthesia team, and they will discuss with you the details of what they're going to do to help take care of you during the operation. Typically, these operations are done with spinal anesthesia, so that means that the anesthesiologist will give you an injection in the lower back that will make the legs go numb. The rest of the anesthesia is done through an IV. That way you don't have any memories of the operation, you won't hear any noises, and it should be a comfortable experience. If for some reason you've had previous back surgery or a lot of arthritis in the lower back, the spinal anesthesia may not be able to be done, and in that case you would have general anesthesia, which again is equally safe. During the time that you are under anesthesia is when we do the operation. We make a small incision right where the front pocket of a pair of jeans would be. We go down between the muscles, we remove all of the diseased bone and cartilage, and we put the artificial hip replacement in its place. That process takes about an hour in total, and within an hour of that, the numbness from the anesthesia should be wearing off and you should be able to get up and walk. At that point, physical therapists will assist you to make sure that you're going to be safe following surgery. When it comes time for the discharge planning, there's two separate pathways. If you're having surgery in a hospital and your surgery is planned for an overnight stay, you'll be transported upstairs to the orthopedic floor. You'll receive nursing care overnight and additional physical therapy. Many of these operations are now being done as an outpatient. So if your surgery is scheduled as an outpatient, and that would typically be done either at our surgery center or it can be done as an outpatient in the hospital, we'll be planning for you to go home the same day. In that case, the nurses and the physical therapists will make sure you have the appropriate equipment to go home with, and we will make sure that you can stand comfortably, that you can use the bathroom, and that you can tolerate eating and drinking. On the first night after surgery, it's important to use pain medication on a regular basis. Whether you're in the hospital or at home, we will provide medications for you, and it's important to stay ahead of the pain because the first night can be a little difficult. After that, things tend to get very easy. Within a day or two of surgery, you'll be visiting a physical therapist. They will take an assessment of you, check your bandages, and make sure things are going in the right direction. And then within a couple of weeks of that, you'll be seeing me again in the office for the first formal post-operative visit. Again, congratulations on making a great choice. This is a great operation, and we'll see you at the time of surgery.